Hi there, my name is Sophie. I'm going to be your student nurse today. Can I go ahead and confirm your name and date of birth? Robert? Okay. Is that how you would like to be addressed? Bob is fine. Perfect. Bob, do you have any allergies that I should be aware of? Tylenol codeine? Okay, I'm going to go ahead and confirm that on your wristband. Looks great. And are you in any pain today? Awesome. We have orders from the doctor to start some normal saline and metronidazole. Normal saline is going to go ahead and keep you hydrated, and the metronidazole is going to help your body fight the H. pylori infection. Does that all sound okay? Awesome. I'm going to go ahead and get started with the flush first to make sure that your IV is working properly. Make sure that there's no occlusions or any air bubbles. Just going to raise the bed to a comfortable working height and make sure I have access to the IV. We are first going to start with just a normal saline flush. Also considering the 5 rights of administration. That would be the right dose, the right person, right time, the right frequency, and the right medication. I am going to clean the port with a prep pad. We typically do this for 30 seconds and wait for it to dry, but for the video we'll do it a little bit quicker. And I would push about 10 cc's of normal saline. Again, just making sure that the IV is working properly and there's no occlusions. Awesome, that looks great, Bob. Did you feel any pain? Okay, we are going to go ahead and get started on your medication. How does that sound? Great. First, we're going to start with the normal saline. I would scan this and confirm the expiration date. It looks great. And then scan it with the patient's wristband, as well as check the chart to make sure that this is the correct medication. And then this would typically be in sterile packaging. We would keep this in sterile, but we will have to clean it anyways. I would remove the cap and spike down and make sure that the roller clamp is closed. Making sure this is untangled, I'm going to go ahead and flush the tubing to make sure that it's working properly and get all the air bubbles out before putting it in the patient. Awesome, looks great. Then I'm going to make sure that the clamp is closed. And again, this either would be sterile, or if it's contaminated, we would clean it with a prep pad. And then also clean the port again to prevent any unnecessary infection. Okay, and we're going to go ahead and get started. start with a new patient, med surge, and we are going to do channel select and enter the patient's ID. Confirm. Here we go, channel A, guardrail IV fluids, main IV, yes, rate of 100 milliliters per hour, and then we would give 950 milliliters because this is a 1,000 milliliter dose or package. We would make sure that it is not given fully so that the air does not enter the patient. And we would start that pump and make sure that the line is not occluded. Then we are going to go ahead and get started on our second medication, which is metronidazole for his H. pylori infection. We would perform hand hygiene again and get new gloves just to be safe. We are going to do the same thing with this medication as we did with the last one by confirming it with the chart, scanning the medication itself, and then also scanning the patient's wristband and checking the expiration date to make sure it has not expired. We would scan, confirm with the chart, and the expiration date looks great. Remove the cap. Wipe down with the tubing, the correct tubing. Make sure that it is down and that the chamber is filled about halfway. This one too, the chamber would be filled halfway as it started, but has been done in previous videos. And then we would clean the site again. It may be in sterile packaging, but to make sure it's clean, we would clean both sides. And put this on here. And then we would fill from below to make sure that we can preserve as much of the medication as possible and bring the air bubbles down, making sure this is not closed. And those air bubbles come down, and we would hang this lower. The secondary IV needs to go above, and then we would add our secondary IV. Metronidazole, 500 milligrams, or milligrams per 100 milliliters. Yes. Next, and start. Everything is unclamped, and we are good to go. And this will be infusing, and the normal saline will begin infusing once this is finished again. Okay, Bob, that's all I have for you for now. Do you have any questions for me? I'm going to double check the IV site and make sure there is no irritation. It looks great. I'm going to lower the patient's bed. Your call light is within reach. I will be back to check on you when the medication is finished infusing. Just call me if you need anything. It says there's air in the line because it's not a real patient. Other than that, we're good to go. Thanks, Bob.